Hello and good afternoon. Thank you for tuning in to our afternoon session here on the New Hampshire Student Wellness page. My name is Molly. I'm joined here today with Richard Weissbourd, and he is here to talk about self-care and balancing self-care with the care of others. So Richard Weissbourd is a senior lecturer at the Harvard Graduate School of Education and at the Kennedy School of Government. At the Graduate School of Education, he also co-directs the Human Development and Psychology program. And Richard's work focuses on moral development, vulnerability, resilience in childhood, and effective schools and services for children. He also directs the Making Caring Common project, which is a national effort to make moral and social development priorities in child raising and to provide strategies to schools and parents for promoting in children caring and a commitment to justice and other key moral and social competencies. He's currently working with numerous college admissions offices to elevate and more effectively assess ethical character, to reduce excessive achievement pressure, and to increase equity and access in college admissions process. He's the founder of several interventions for at-risk children, including ReadBoston and WriteBoston, a citywide literacy initiative led by Mayor Menino. He has a pilot school in Boston, the Lee Academy, which begins with children at 3 years old. And he has numerous blogs and publications. You can find his work in the New York Times, the Washington Post, Psychology Today, NPR. And he has 2 books, The Vulnerable Child and The Parents We Mean to Be, which was named the New Yorker as one of the top 24 books of 2009. So Richard is here today. Like I said, he is going to be sharing with us some tips and ideas about self-care. I have a few questions for you. Is there anything you wanted to share?
No, I'm just delighted to be here. And Molly was a former student of mine, and so it's always a real pleasure to see my former students doing such wonderful work.
Yeah, you are a great professor. So jumping right into the topic, could you share with us what self-care is and why it's so important? It's something that's coming up a lot in the media, in the wake of COVID-19.
Yeah, I think a lot of us are feeling stressed. I think, stressed about ourselves and family members, and also depressed about what's going on in the world. I mean, it's a very hard time for a lot of people. And, if you're an empathic person, and almost all of us have empathy, we're concerned about lots of people out there, whether it's, people working on the front lines of hospitals or people delivering food. There are all kinds of people, or people in developing countries, or people in low-income communities. So it's a time where we can feel overwhelmed by what's going on in our families, and overwhelmed by what's going on in the world. So, I think taking care of yourself becomes very important. Some people, parents especially, are also under an enormous amount of stress. There are a lot of parents, many of you who are listening, who are single parents, who have 3 or 4 kids at home, and you can't go out and you can't really have visitors. And, in these situations, it's really important to find ways to take care of yourself, whatever that is, whether it's doing yoga or going for a walk or meditating or reading a book or watching a favorite TV show. I think it's really important to protect that kind of time to renew yourself. So when I think about self-care, that's really what I'm referring to.
Excellent. I agree. Self-care is one of those things I know I need to do it, and then sometimes I forget I need to do it. So it's important to hear you talk about it like that.
And I think your point about forgetting to do it and just finding something that's, for a lot of people, finding something that's consistent and routine and every day can be very helpful. For a half an hour at this time of day, when I know that I'm likely to feel low or anxious, I'm gonna remember to do this thing that helps me calm down, self-regulate, renews me too.
Awesome. So in thinking about self-care, you mentioned, single parents and the such. How do you recommend, or how do you even think about balancing self-care with caring for others?
Well, I think that there are many forms of caring for others that are self-care. So when, for lots of people, focusing on yourself too much can be unhelpful, or dwelling on anxieties you have about yourself or the world can be unhelpful. Focusing on other people can be helpful. So, particularly for people who are in more privileged positions now, who, don't have many kids that they're taking care of, sometimes focusing on, how do we contribute to healthcare organizations, whether, it's making masks, or volunteering to get groceries for a senior citizen in our neighborhood. I mean, there's a range of kinds of ways we can support people. Some people can be in a position to make donations. All those things, I think, it'd be helpful in terms of a balance, and they can also mitigate the kinds of anxieties that can become so debilitating during this time. There's a whole other issue of people, who have dependents, who are taking care of people all the time. And again, I think if you're finding yourself in a position where you're taking care of people all the time, and particularly if you find yourself getting irritated or easily triggered, or in downward spirals with people you're taking care of, where you're irritable, which makes them do something that makes you even more irritable, which makes them do something that continues to exacerbate your irritability. Those are times where it's really important to self-manage, self-care, and to do those things that renew you.
Awesome. I think even in my own personal experience, the irritability is definitely something I'm working through.
Yeah, a lot of us are irritable right now, right? So it's hard not to be irritable sometimes. And, a lot of times in family relationships, we spend many years figuring out boundaries in our family relationships, right? Like how to regulate closeness and distance in our family relationships. And, we know that there are times where we, as much as we might love a family member, we need relief from them. And we organize our lives so we get that relief, right? That we have moments of closeness and also moments of distance. And that's a healthy thing, that we're able to regulate that closeness and that distance. But this period messes up all that, right? It's really hard to have boundaries. It's really hard to regulate closeness and and distance. And so we have to renegotiate those boundaries a lot, and we have to rethink them. And sometimes that means, having a democratic household where people can really have input, and you can figure out how to negotiate those boundaries again.
Absolutely, yeah. So do you have any tips for remotely caring for others? So, obviously we can care for the people in our household, but if we have other family members or friends that we can't actually interact with or interface with?
I think there are a lot of people who are very isolated during this time. And, I think of senior citizens. I think of a lot of people living alone. And, in my experience, those people really appreciate when you reach out to them in whichever way is appropriate. If you can FaceTime with them, or Zoom with them, or text them, or give them a call. All those things are helpful. If you can offer to buy groceries for them one day, that's helpful. If you feel safe, if you can go for a walk with them, maintaining appropriate distance, maintaining 6-foot distance, and wearing masks and doing all the things we need to do these days, I think those kind of things can be helpful. So, there's a way in which, I'm finding this is Zoom and FaceTime, it makes it all harder, and it's not as immediate, and it's not as close. And I think a lot of us are feeling that. But on the other hand, I think a lot of us are also realizing how easy it is to be able to FaceTime and Zoom with somebody. It's better than being on the phone. And particularly when people are feeling so isolated, I think it's very helpful. And the other thing I would just say is that, there are a lot of people who have jobs that are very social, where they're in contact with people all the time. And for those people to be home alone all the time can really feel like a serious loss and a withdrawal. And sometimes those people especially need to have more contact during the day.
Yeah, you raised an important point of, I, by way of my work, I've always been interacting with people, and now we've kind of found ways, almost naturally, where we're calling or texting each other just to kind of maintain some of that social interaction. Could you talk a little bit about guiding our kids in this time for caring for others and how we could work through that with them?
Yeah, I mean, this is something that I think differs depending on the age of your child. But, my sense is that, first of all, most kids want to know how to be helpful during this time. It gives them a sense of control to be helpful. That, it can be very damaging to kids to be passive in the face of things that are troubling. That it can help mitigate, reduce their own anxieties to be helpful. And it's a very good thing to do. The most important thing to do, and, in my view, is to help our kids, for a variety of reasons, be good and caring human beings who can focus on other people. So, whether it's gratitude, whether it's sending thank you notes to firefighters or healthcare workers, or food delivery people, or, people who are at risk, or buying groceries for a neighbor, or sewing masks, or doing research on volunteer organizations, or places that are being helpful during these times and doing research about how to support those, or encouraging kids to rally their friends to help neighbors or elderly folks. I mean, there are a lot of things that kids can do during the time, again, depending on their age. And I think these are great reflexes to build in kids, that this is how you build empathy and caring, is by making it a practice. It's like learning an instrument or a sport, or building a muscle. You need to practice. This is a great time to practice doing those kind of contributions.
Yeah, I actually heard you talk on one of the Harvard talks that you were giving about expanding your circle of concern. I think that's really what it sounds like. What to help kids in caring is really expanding who they're thinking about.
Yeah, no, I think that's right. I mean, almost all of us, I mean, with the exception of sociopaths, have empathy for somebody. We have empathy for family or friends. A much bigger issue in some ways is, who do we have empathy for? And do we have empathy for people who are different from us in race and class and gender? Or do we have empathy for people who may be invisible to us in some way? During this time, a lot of people can fall off your radar. You may not think about the risks to people who are making our food, or the people who are delivering our food, or the risk to sanitation workers, the risk to custodians, the risk to receptionists in hospitals. But these are all people who are in dangerous positions, who are doing something brave and altruistic. And, we should help our kids appreciate those people now. That's how we expand their circle of concern.
Absolutely. I mentioned in your introduction about the Making Caring Common project. Would you be willing to share a little bit about that project with us?
Yeah, I'm delighted to. So Making Caring Common is really based on research that we have done. It's really based on two things. One is research we've done over the years about the degree to which parents and teachers are prioritizing caring in child raising. And one of the things we find, to make a long story short, is we probably surveyed 50,000 middle and high school students by now. And one of the things that we find is that kids tend to prioritize achievement and happiness over caring.
Wow.
And they tend to think that parents and teachers prioritize achievement and happiness over caring. So there's a degree to which we have elevated achievement and success and happiness as the primary goals of child raising, and demoted or marginalized caring for others in child raising, that is very concerning. And I think if you look at the problems we're having in our country right now, the degree of hyper-individualism, the monopolarization that we're having, the amount of name calling that we're doing, if you look at those people who are not social distancing and washing their hands and not really thinking about other people, there are many causes of this, but I think one cause is the degree to which we have elevated personal well-being over caring for others in our culture. So Making Caring Common is in part about making concern for others, making concern for the common good front and center again in child raising. And we do that through media. We work with children's television shows. We do that. We write reports. We work with college admissions around sending signals about how important ethical character is. We also are about giving parents and teachers concrete strategies. So we give parents and teachers, educators, concrete strategies for building empathy and caring and self-awareness and social awareness and a commitment to justice in kids. Activities, strategies that are low burden, easy to implement, and we think have significant impact.
That's awesome. I was a teacher for many years, and thinking about those initiatives that I tried to launch in my classroom, the ones that had the concrete, like, this is what we're going to be implementing, was just the most beneficial for me personally as a teacher. So
Oh, great.
that's great to hear.
Great.
I remember when you said that statistic in when I was your student about how students seem to think adults prioritize academic achievement. And I was like, you know what? Yeah, as a student, I definitely felt that way. It was like really impactful to see. I felt that way and I wasn't even really aware of it as a student.
Yeah, I mean, one of the things that's sort of interesting and troubling about this is that when you ask parents, what do you prioritize in child raising? They don't say achievement, they say caring.
Right.
When you ask teachers what they prioritize in educating, they don't say achievement either, which is interesting. They say caring. So there's this gap between what teachers believe, what parents believe, and what kids are absorbing. So teachers think that parents think they're promoting caring. Kids, by large margins, think that parents care more about their achievement than about whether they're caring. They're 3 times more likely to say their parents will be proud of them if they get good grades than if they're caring people. Kids similarly think that educators are, a great majority of children think educators' primary role or primary belief is the importance of their achievement. I understand that. I mean, I think kids associate school with academic achievement. But what's interesting about it is when you ask educators what's most important to them, as I said, they don't say achievement, they say caring. So again, there's this gap between what teachers believe and what teachers are trying to do and what kids are absorbing and perceiving.
Wow. I wonder if it's as simple as having a conversation with students, or how can we work toward aligning those two?
You know, it's a great question. Like in a school setting, you know, one of the things that we're doing is, you know, we encourage educators to give brief surveys to kids where you ask them, what's most important to adults in this building? Is it that I'm a good person, a good citizen, or is I get good grades? Or how important how important are these things to the adults? Is it very important to adults in the building that I'm a caring person? And monitor that and see if you can make a difference. And you know, there are a lot of things that a school can do to prioritize caring. You can make caring and themes around the common good and themes about justice, themes about bullying, racism, sexism, sexual harassment. You know, the degree to which schools are really focused on these different aspects of caring for others, it will start to be reflected in what kids see as the priorities in the building.
Hmm.
So I think you can move the needle on these things. And I think adults can say it too. Parents can say it too. I wish parents, instead of saying the most important thing is that you're happy, I wish they said the most important thing is that you're kind. You know, of course I want you to be happy as well, but the most important thing is that you're kind.
That's awesome. Yeah. That's awesome. Are there any resources that you found particularly helpful in this time at all?
You know, I think that there are a lot of resources out there. There are a lot of resources, activities that you can do with your kids while you're at home. You know, Challenge Success, it has activities around academic work. We have some activities on the Making Caring Common website around developing relationships during this time and developing empathy and care during this time. You know, the Boston Children's Museum has lots of resources around activities that you can do with your kids. So there are a bunch of those kind of resources out there. Those are a few that come to mind.
Excellent. Yeah, I did include a link in the description of this for the Making Caring Common website, mcc.gse.harvard.edu,
Right.
um, for access to some of those resources. We did have one question from the field. Do you have any specific recommendations on specific self-care techniques?
I think it's a great question. I think these vary by who you are and what you find calming. I think there's simple breathing exercises, meditation breathing exercises where you breathe in, breathe out, count to 10. LeBron James does one. If you look at LeBron James meditation exercise, a lot of people find it helpful. But for some people it's exercise, some it's yoga, it's a lot of different things. So I think it's knowing yourself and what will calm you down, I think is one of them. Meditation works for a lot of people. I mean, I think that's really something to think about. And if you don't have the time to carve out 20 minutes a day or 15 minutes a day to do it, there are things that you can do like during the day just to take 1 or 2 minute breaks, just to think about your breathing, calm down, try and clear your head. That can be helpful. These really brief meditation exercises done at several points during the day, people often find helpful.
I think that's so important. Even personally, I'm always like, I need to carve out this chunk of time and I'm going to focus on self-care. But those small intermittent breaks is a really interesting way to think about that.
Yeah, there's some evidence that it isn't, I try to do a walk a day, a long walk a day. There's some evidence that's better, particularly during this time, to do 2 or 3 short walks a day, just in terms of, warding off anxiety and depression, frankly.
Yeah. And, I tried yoga and typically love yoga, but found that it kind of opened up my mind space to spiral into, other,
Yeah.
other areas that I didn't really want to be.
Well, this is no, that's a really important and interesting point. And, this is one of the reasons why, this is a lot about trial and error too, I think. It's about trying things and, meditation, yoga really are not for some people. And, they can have some of the unintended consequences that you're describing. And then you got to try other things. And this is hard, when you're feeling anxious, it can be hard to try a lot of different things. But this is just one of those things where it can take a while to find the right sort of path or treatment for people. And there's nothing out there that I've ever found that is magical either. There's nothing that I've ever found. And I'm a person who gets stressed and anxious. There's nothing I've ever found that magically lifts the stress or anxiety, but there are things that I found that have reduced it significantly, particularly if I do them consistently. And I think that's true for a lot of people.
Consistency. Yeah.
Yeah.
Do you have any final words for, the adults, parents, and teachers that might be feeling anxious or stressed, not just about COVID-19, but kind of about all things related to academics and learning and caring?
I think that I would just say that in addition to the things that we've talked about, maintaining connections to other adults and maintaining connections to adults who you feel renewed by and appreciated by can be very important. That isolation itself, breeds stress. I also think that if you really feel like you're dealing with serious mental health concerns, and many people, are or will be during this time, it's very normal, but you should try and access resources to deal with it. Whether it's contacting your physician and asking for a recommendation for a mental health provider, or contacting a community health center or mental health center. If you feel like you're really dealing with heavy amounts of anxiety or depression, I think those things are really important. But I'd like to end on a different note, which is that I do feel like in general people are really being supportive, responding to this time, showing a lot of courage. and that all the efforts, in many ways, the people who are struggling, who are really isolated, are also people who should really be commending themselves because they're protecting other people. Their isolation is protecting other people, and that's, that's I hope is gratifying to them, and it's a wonderful thing and a vitally important thing to do for all of us right now.
Yeah, what an important way to think about it. The social distancing that we're doing right now is really for the benefit of all. That's great. Thank you so much for joining us today and taking the time out of your day. I want to thank everyone who tuned in and posted questions, and we hope you have a great weekend, and we'll see you on Monday morning at 9 a.m. for our next session. Have a great day and be well.
Thank you, Molly.